Hi, I'm Scott Bruner. I'm here with Ali Jo Shipman and Matt Magner. We are your NCPA State Government Affairs team. As legislative sessions wind down in a number of states, we thought it might be a good time to provide you a bit of an update on a number of victories that community pharmacies have achieved in these legislative sessions across the country. I guess the marquee bills have been bills in Arkansas, and in Kentucky. Arkansas passed what we believe is the most comprehensive regulation of PBMs in the country. Kentucky passed what I think it would be fair to say is the most comprehensive PBM disclosure legislation in the country. Both of those are summarized in our June issue of America's Pharmacist magazine. May issue of America's Pharmacist magazine. So you can find out more specifics about that legislation there or on our website. But there's an awful lot of other stuff going on in states. Good stuff has happened. And I'm happy to say that NCPA has been a central part of those successes. Over the past 8 or 9 months, we have assisted, supported 38 different states on a range of bills, probably as many as 90 or 100 pieces of legislation. By support, I mean we have helped in bill drafting. We have helped in bill review, recommending to states changes to legislation that's been introduced that would improve the legislation. We have provided written testimony. In one instance, Matt, you were in Illinois and actually provided in-person testimony to a legislative committee. We have provided grassroots calls to action. And so we are awfully proud of the success that our state partners have achieved, but we're also proud that we've been a part of that success. So the legislation that's passed kind of falls into some different barrels. The first one is really sort of our sweet spot, a major priority issue for us, and that is PBM regulation, patient protections, legislation that would enable pharmacists to be able to share cost information and other information with their patients. Matt, can you give us a quick overview of what's going on there, and then we'll jump to Ali Jo for a quick assessment of some of those other issues that have passed.
Sure. So in terms of PBM regulation, we've seen a few different types of provisions, including Arkansas, Florida, New Jersey, and Tennessee now require PBMs to register with the state in order to operate in the state. Alabama and New York have passed fair pharmacy audit legislation, mainly strengthening what was already on the books. Just in general transparency terms, Arkansas, like Scott mentioned, has passed a comprehensive legislation that allows their insurance commissioner to review and approve PBM compensation programs. Florida and Maryland have strengthened their MAC transparency laws, and Louisiana passed legislation requiring PBMs to submit annual transparency reports to the insurance commissioner. In terms of patient protection provisions, they have sort of run the gamut, and a lot of states have actually passed patient protection provisions. Arkansas and New Hampshire have passed legislation prohibiting PBMs from requiring accreditation and certification standards that surpass what is required by the Board of Pharmacy, so it'll open up the networks and make patients have more access to pharmacies.
And I'm going to interrupt you there. That's an important bill for us. That is a priority piece of legislation. Many of you know how PBMs are creating these bogus certification accreditation requirements. And in these couple of states that Matt has mentioned, they've tackled that, prohibited that in those states. I suspect that will come back around in some other states for the 2019 sessions. We would certainly encourage states to do such prohibitions. Sorry to interrupt.
Oh yeah, no problem. Also, Mississippi, New Hampshire, and Virginia have passed legislation regarding medication synchronization. So patients in those states can synchronize their medications now without a prorate or with a prorated copay. A long list of states have passed laws dealing with the ability of pharmacists to disclose options that will lower the cost to patients, so whether that's a lower cost generic or perhaps an entirely new method of purchasing a drug, such as purchasing for the cash price instead of using the public or the prescription drug benefit program. Arizona, Arkansas, Colorado, Florida, Indiana, Kansas, Kentucky, Louisiana, Maryland, Minnesota, Mississippi, New York, South Carolina, South Dakota, Utah, Virginia, and West Virginia. So that's something we're seeing all over the nation. Similarly, the copay clawback has been addressed in many states: Arizona, Colorado, Florida, Indiana, Kansas, Kentucky, Louisiana, Maryland, New York, South Carolina, Utah, and Virginia. And South Carolina and Virginia have also passed legislation regarding retroactive adjudication fees. And so those fees can't be charged unless certain conditions are met in those states.
It's a pretty hefty report. A lot of activity, as you can see, on PBM regulation and legislation that will help pharmacy patients. And obviously, if it's good for pharmacy patients, it's good for independent community pharmacists. So now, AJ, there's been legislation on a number of fronts. Prescriptive authority, expansion of scope, several other things. Can you update us on those bills?
Sure. So being a pharmacist myself, I always love to see when states pass things related to expanded scope of practice, prescriptive authority, compensation for services, and in that vein, Colorado is probably our newest state that passed something, kind of a state version of provider status or compensation for services that pharmacists provide to patients in health professional shortage areas. So that was a big victory out in Colorado. As far as scope of practice, we've had several states that have moved the needle there too. So Iowa, Mississippi, New York all expanded immunization authority for pharmacists. Iowa also now allows pharmacists to prescribe nicotine replacement for smoking cessation. And Utah and District of Columbia also have prescriptive authority for pharmacists related to hormonal contraceptives, so those are all really great victories. A couple of other states have passed some things that would still be considered scope of practice. They may not be as sexy as some of the other things that we talk about a lot of times, but they make a big impact in patient care and in pharmacy workflow. So Idaho passed a piece of legislation that now allows therapeutic substitution, so pharmacists can do therapeutic substitution under certain conditions, and Maryland passed legislation this session allowing pharmacists to do up to 90 days of fill on a prescription as long as the quantity is enough to allow 90-day fill. So if a patient brings in a prescription with an original 30 quantity, but it has enough refills on there to allow a 90-day fill and the patient wants that, the pharmacist should be allowed to do that now in Maryland. We've also seen some good movement in the controlled substance space, especially related to opioids. So a couple of the, really good ones, especially that cross over into that scope of practice. Kentucky passed legislation that's going to create a pilot program for medication-assisted treatment of substance use disorders in community pharmacies. So that's a big deal. And Iowa and Maine also passed legislation. Maine actually overrode a veto on their legislation, allowing pharmacists to prescribe and dispense naloxone. So we always think that's a huge victory.
Sure.
Protection for patients. And Louisiana and Tennessee also passed legislation allowing partial fills of C2. So that's a big deal, especially with patient access and making sure we don't have too many opioids or other controlled substances out there that maybe don't need to be used by patients, but in the past they weren't able to get just the amount that they needed from their prescription. They had to get the whole thing. So we think those are really good victories in Louisiana and Tennessee.
Good. Great report. As you can see, the legislation is really all over the map. There's not a single state where an identical bill in one state passes in the same form in another state. Our job is to support our state partners, the state pharmacy associations, our buying group partners, and others, in making sure that the legislation as introduced, as passed, is good for our independent community pharmacy owners. We thought this would be a good time to bring you an update. There is legislation still in the pipeline, and so when we get to the NCPA annual convention in October, which, by the way, we hope you'll register for soon, we'll be able to give you a fuller report on what's happened in every state across the nation. I know there's legislation still pending in California. AARP has signed on in support of that bill that the California Pharmacists Association is pushing. That's one we're watching, and quite a few others. So thanks for the opportunity to bring you the update. Stay tuned. There's more to come.